Hi, my name is Amy Vibert, and this is my poster presentation for NSC 892. My topic is how to decrease antibiotic overuse with respiratory tract infections. My question is, can the introduction of point-of-care C-reactive protein testing in a primary care office decrease the number of antibiotics prescribed for respiratory tract infections? Respiratory tract infections are the most common reason to consult a primary care physician and account for about 75% of antibiotics prescribed in Western countries. Overprescribing of antibiotics when unnecessary leads to antibiotic resistance. Utilizing a point-of-care CRP can decrease the number of antibiotics prescribed for respiratory tract infections, thus decreasing the overall amount of antibiotic-resistant bacteria. Most respiratory tract infections are self-limiting and viral in nature. Complications are rare, and there's usually little or no benefit to antibiotic therapy. A randomized control trial will be designed with the experimental group participating in CRP testing and the control group obtaining treatment as usual. The research that I've done for this project has shown that through utilizing the CRP testing and standardized instructions on when to prescribe antibiotics will decrease the overall use of antibiotics in respiratory tract infections, which is promising information whenever you're trying to limit the use of antibiotics through interventions that physicians or nurse practitioners can do. Based on the literature review, more antibiotics are prescribed when the CRP is not evaluated. Antibiotics can be prescribed when CRP is greater than 100 milligrams per milliliter, and we have a delayed antibiotic prescription rate whenever CRP is 20 to 99 milligrams per milliliter, and antibiotics are not given when the CRP is less than 20 milligrams per milliliter. Obviously, in the research that I did, they also take into account the patient's assessment and other things as well, but the CRP gives a standardized number that's easy to utilize and easy to recognize when antibiotics need to be given and when they don't. In conclusion, the ultimate goal of the project is to decrease the amount of antibiotics that are unnecessarily prescribed for respiratory tract infections, and this, in the research that I did, the results were positive. There were less antibiotics prescribed when CRP was utilized. So I feel like this is an easy thing to implement into primary care, urgent treatment center offices, that would be easy to use, easy to explain to patients, easy to explain to providers. It would give the nurse practitioner the opportunity to do some education with patients and teach them that there are reasons why we don't always prescribe antibiotics for respiratory tract infections, that they're not always necessary, and that they do lead to antibiotic resistance. Thanks. Bye.